Hello and welcome to this special focus show. Today we're going to be discussing the Help Us Help You pharmacy campaign launched by the NHS England to inform our viewers on the conditions that community pharmacists can now treat you without having to see a GP first for a prescription. That's a welcome development, truly. We'll be talking to a community pharmacist about the 7 conditions that the pharmacist can treat and provide medication for without a prescription and a need for a GP. These conditions include earache, impetigo, infected insect bites, shingles, sinusitis, sore throats, and urinary tract infection, along with new oral contraception and blood pressure services. The new service aims to free up 10 million GP appointments a year, making it simpler for the public to access healthcare on their high street and giving them more choice in where and how they access care.
In terms of like certain conditions such as shingles and insect bites or sinuses, urinary tract infections, earaches, you can now go to the pharmacy rather than going to your GP and waiting for a long time. Did you know that?
I didn't know that for all of that range of conditions, but I think it is a good idea, yeah.
No, I didn't. So, more than likely, usually you've got like a ear infection, or you need more asthma pumps, or you need a quick fix. You've got to go through the GP. But now it's been possible that we can go to the pharmacy to get things like if you've got a throat infection or whatever, to get tablets there. It's a lot more hassle, less stress, especially for the elderly people. Great idea.
Instead of waiting for quite some of time for appointment, it is better you to go to the pharmacy and get the medicine from there.
I think definitely knowing the waiting list when you're trying to call for an appointment could be up to 3 weeks, 4 weeks. It would be nice to know you can hopefully go into a pharmacy and they can give you some support, or the same thing what you would needed to do is go to the pharmacy to get the medication, to get it straight away from them, yeah.
So joining us today is the director and pharmacist at Swinford Pharmacy, Olutayo Arikawe. I hope I've pronounced your name correctly.
Yes, you've done well.
Okay. She's a multi-award winning experienced pharmacist and public health practitioner with a demonstrated history of working in the hospital and community pharmacy. So you are welcome, Olutayo. You're very welcome to our show today. So we'll delve right into it, right? So Olutayo, can you tell us what is the community pharmacist and what services do they provide?
Okay. So a community pharmacist is a qualified healthcare professional who can offer clinical advice and over-the-counter medicine to effectively and safely manage a range of minor health concerns.
Right. That's quite simple and clear. But let's dig deeper. So what conditions can the pharmacist treat now? What are they able to treat, the pharmacist? Because this is new for all of us, isn't it? So what can they treat?
We're able to treat the following. If you're suffering with sinusitis and age 12 years and over, we can treat you if you're over 5 years and have a sore throat. We can also help with earache in those between the ages of 1 and 17 years old. If you have an infected insect bite, if you suffer from impetigo, shingles in those over the age of 18 years old, and uncomplicated urinary tract infection, also known as UTIs, in women aged 16 to 64. Right.
So for the UTIs, it's in women aged 16 to 64.
64. Yeah.
Okay, interesting. So why really have these new services been introduced? Not like, I mean, a part of me is saying it goes without saying, but let me hear from you, the expert, that why have they introduced this now?
Is to make it easier for patients to get the care that they need. Pharmacies sit at the heart of their communities, which make them very accessible. There are over 10,000 pharmacies across England offering this service on the high street. So people can just, walk into their own local pharmacy. Another very important reason is that this service frees up GP appointments so that they can see more patients. As now, you don't need a prescription to get medication for these 7 minor ailments.
I tend to go to GP first. I think most people would, because you want the idea of having an expert informed opinion before you purchase something. Whereas at pharmacies, you might feel there's the extra sell angle. Everybody sees them as just normal retail shop staff. So most people still always want a qualified professional. Even though those guys are qualified, it's not advertised or pushed enough.
No, in the local communities, many people wrongly believe pharmacists are not qualified to give medical or clinical advice. So how would you respond to this? Help us get you.
Well, pharmacists are more than qualified to treat these minor health conditions.
Okay.
Every pharmacist trained for 5 years in the use of medicine, which involves 4 years at the university and then a placement year working in pharmacies within the community. As part of our clinical training, pharmacists are taught how to manage minor illnesses and provide general health and well-being advice to help people stay well. We also work with pharmacy technicians and our pharmacy team.
Amazing. So if I was suffering from an earache, do I need to make an appointment to see the pharmacist, for example? In fact, I just healed from an ear infection, actually. But let's just assume, because it started from earache,
Yes.
right? And so if I'm suffering from earache, I waited about 10 days to get a GP appointment.
Okay.
And by the time I went to the GP, it was infected. So let's assume I rewind, okay? That's my earache. Do I need to make an appointment as well to see the pharmacist?
Well, for now, the service is for those, that are less than 17 years old. The beauty of this service is that you don't need to book an appointment to be seen by your local pharmacy. You can walk straight into a participating pharmacy and speak to their team. If you are worried about headache, impetigo, infected insect bite, shingles, sinusitis, sore throat, or urinary tract infection, a pharmacist will be able to offer advice or provide medication if it is appropriate.
Okay.
Also, if you're a bit worried about people listening to your conversation while in the pharmacy, you can always ask to speak to a pharmacist in their private consultation room. So, most pharmacies now would have a consultation room, and all you need to do is to ask to speak, privately.
Yeah, I think that's really important because people want to keep their private business private, isn't it?
Yes.
Yeah. So that's good. So seeing as you are here with us today, we have asked our viewers to send in some questions. So we are going to throw those questions on you. Hopefully you're able to catch and do justice to them. So a viewer says that he has a sore throat. What should he do?
Well, sore throats are very common and usually nothing to worry about. They normally get better by themselves within a week. You can treat a sore throat by yourself by gargling warm, salty water, but don't let children try this. You can drink plenty of water, eat cool or soft food, avoid smoking or smoky places. You can suck ice cubes, ice lolly or hard sweet, but do not give young children anything small and hard to suck because of the risk of choking. And most importantly, rest. For those who are 6 years and over, your pharmacist may advise that you take paracetamol or ibuprofen, medicated lozenges containing a local anesthetic, antiseptic, or anti-inflammatory medicine. And to relieve any pain and discomfort of a sore throat, you can buy this treatment from a supermarket or from a pharmacy without a prescription. A pharmacist can also provide other treatments if you need them without you seeing a GP.
Awesome. So sore throats, no more GP, straight to the pharmacist. That's great news.
That's it.
Yeah. So sore throats are one of the very common ones, isn't it? With our weather and everything. So yeah. So hey, no more GP for sore throats, straight to your pharmacist. You can get help. Right. So we have another listener who has written in and said that they have an insect bite. If they went to the pharmacist, what kind of treatments would they expect for an insect bite?
Okay. So insect bites or stings are not usually serious, and they do get better in a few days. But sometimes they can become infected or cause a serious allergic reaction. Bites from some insects can also cause illnesses, such as Lyme disease from ticks, scabies from mites, and malaria from mosquitoes in certain parts of the world.
Right.
The main symptom of an insect bite or sting is the pain where you were bitten or stung. There might be a small swollen lump on the skin. The lump may look red. It may be more difficult to see on a black or brown skin, but you should be able to feel it. A pharmacist will talk to you about the different medicines that could help ease the symptoms, such as antihistamines, steroid creams, and painkillers. They can also provide other treatments if you need them without seeing a GP.
So the big theme is without seeing the GP. That's the
We
big
can
theme
help.
here today. Yes. And GPs are doing a fantastic job, but we all know how overworked they've been over the years. And
Yeah.
this initiative is really, a breath of fresh air. Another listener says that it burns when they pee. Do you have advice for them?
Urinary tract infections, UTIs, affect your urinary tract, including your bladder, cystitis, urethra, urethritis, or kidneys, which may be kidney infection. UTIs may be treated with antibiotics. They're not always needed. There are lots of symptoms of a urinary tract infection. This may include pain or burning sensation when peeing or using the toilet, needing to pee more often than usual, and especially at night, pee that looks cloudy or has blood in it, lower tummy pain or pain in your back, just under the ribs, a high temperature or feeling hot and shivery, a very low temperature below 36 degrees tend to be. Your pee may also be dark or smell. If this is your only symptoms, it might be because you've not been drinking enough water. Women aged 16 to 64 can ask a pharmacist about treatment for a UTI. They can offer advice on things that can help you get better. They can suggest the best painkiller to take. They can provide the same treatment as a GP if it is suitable for you. They can tell you if you need to see a GP about your symptoms.
The first point of call, of course, is you, the pharmacist.
Yeah.
And if it's more than, hoped, then you can advise to go on to the GP.
Exactly. We're trained, to know when to refer.
Right. Okay, good. So moving on to more questions. Can someone get antibiotics from the pharmacist without a prescription? Antibiotics are a big one, isn't it? So can we get antibiotics without a prescription?
If it is appropriate, without the need to visit the GP, patients will have a private consultation with the pharmacist who will fully assess their condition before offering advice and confirming whether any medicine are necessary. It is important for people to know that pharmacies will only supply prescription medicine if it is appropriate. They will also advise on any alternative self-care option and can signpost you to other care services if needed. And I must say that most pharmacies are antibiotic guardian. So we will not just provide antibiotic willy-nilly for when it is needed.
Okay, all right.
Following a private consultation with a pharmacist, if appropriate, you can now also get antibiotics from your pharmacist without prescription from the GP.
Okay.
Do you know that, or what do you think?
No, I didn't know that. And as I just said earlier, I feel like if it's anything that's going to not delay the time that people are waiting and could be getting support, it's great to know that you could get that service.
But it's a good thing. I think that having a pharmacy now is like a second base towards going to the GP is good. It helps everybody as well, so especially the local, the community, 100%.
It's something you'd consider. But as I say, the key thing will be to let people know that once you walk into that store, that person is accredited.
But it makes it easier, because sometimes you call a GP up in the morning and you're not going to get through for an appointment for another 3 days. So being able to go straight to the pharmacy and get things sorted out, it's a brilliant idea. It's good, it's great.
So will the pharmacist be able to still do blood pressure checks? I know that has been a service that has been there before, but can they do it for free?
Yes, you can get a free blood pressure check at your community pharmacy if you're
Great.
age 40 or over and live in England. But you won't be eligible for a free blood pressure check if you've already been found to have high blood pressure or you've had a blood pressure check by health professionals in the past 6 months. We do a lot of blood pressure checks in my pharmacy, and it is fulfilling when you do one and you help to save a life. Sometimes, you do somebody's blood pressure who has come for just paracetamol, and you check their blood pressure and it is, very high. instead of sending them to A&E. So it is part of those fulfilling one that we do, meaning that we've saved somebody.
Is this available in all the participating pharmacies, what you've just explained?
Yes,
Okay.
it should be.
Okay. All right. Thank you so much, Olutayo. You have been of so much help, of great help to us and to the viewers who's listening. It's always very interesting when we do these interviews because, we are human as well. So we are keenly listening to hear, what help we can get. And you have delivered that today. So thanks so much for answering so many questions. It has been really interesting and informative for our viewers. But a few more questions to go, actually, to wrap up. But this is to wrap up. Okay. So where can the viewers find out more about what pharmacists can offer?
So they can go to this website, nhs.uk/think pharmacy first.
So if you want to find a pharmacy in your local area that can help with these ailments we've talked about in the show today, the website is nhs.uk/think pharmacy first. Thank you once again, Olutayo, for being here with us today and for all the information. Thank you.
Thank you too.
Bye-bye.
I would say it is good to go to the pharmacy because it is it's not required to have an appointment. You just go.
I think they would also be in the position to then tell you if it's more severe to then, for example, go straight to A&E, or you definitely need to see a doctor because they're not qualified, where some things they, as you said before, some of those, ear infection, for example, they'll be able to give you, antibiotics or whatever medication you need for that.
It's very much easier for us to go to the pharmacy and get the medicine that you want to get.
Don't wait for those minor concerns to get worse.
Think pharmacy first.